Hello, good afternoon, everyone. I am Dr. Inam Aboud of the Harley Street Health Center. I started the clinic in 1998, so it's 27 and a half years ago. And it is my privilege to talk to you about a subject that is really very close to my heart. It is one of the most important subjects that is actually being looked into further and further, and more research is being happening, which is gut health and its effect and influence on the rest of the body, including the brain. We see as doctors many patients presenting with digestive issues, bloating, tiredness, brain fog, joint pain, muscle ache. And we usually, as in orthodox medicine, we take it as face value. So doctors do blood tests, they examine the patient, they say, well, there is nothing wrong with you, which is really it's very disappointing for the patient. It can be very confusing, and indeed it can cause them to have low mood and even depression. Because it's nothing worse than you feel the symptoms and somebody who is a doctor with authority to tell you, there's nothing wrong with you. Your blood tests are normal. My examination is normal, apart from you have gas in your stomach and your abdomen. It's IBS. So you are stressed and you need to really sort yourself out if you are stressed. And unfortunately, this happens particularly if the patient is a woman and middle-aged or older age. Gut health is so very important, understanding what is going on inside our bodies and inside the patient body and how is it related to their symptoms. We know that we have, all of us, good bacteria in layman's term. We can call it microbiota, we can call it the microbiomes. And previously, we thought of it's important for our digestive system. But it is by far more complex than it is. I'll give you an example and some new studies that have actually had happened. These bacteria, there are different strains of bacteria. They live in the gut, in the colon usually, in a particular pH, which is usually alkaline pH, and they protect the digestive system, but they also are responsible for absorption of nutrients, and they are also, which I will elaborate later on this point, are responsible for the production and the absorption of a tryptophan, which is very important for the brain, for the neurons to make serotonin. Okay? So if these bacteria are not happy, they are weakened. And how do they get weakened? Courses of antibiotics, because antibiotics, as you know, broad spectrum, they kill the good and the bad. Bad food, fatty food in particular, salt also, high sugar content and refined carbs. They are not happy. So what happens when they are weakened? pH will change, this is going to allow bad bugs to grow. Yeast is very common. Candida species, Candida albicans, can grow. And other bacteria, pathogenic bacteria. And what unfortunately happened when these bacteria and yeast happen, they don't stay in the colon. They climb up into the small intestine, up to the mouth, which is, it's common, but it is not being taken into consideration or account when patients are presenting with their symptoms. So say, for example, with yeast overgrowth, what does it do? Any of you, when you bake bread or watching anybody baking, we get the flour, we put water, and then we add yeast. It's the same yeast. You cover it, keep it in a warm place. What will happen? The bread will rise. The dough will rise. And why does it rise? Because the yeast eats up the sugars, the gluten, and produces carbon dioxide, which will make the bread rise. And there is also alcohol. When we put the dough in the oven, the alcohol will disappear. Same process happens inside our gut, but the alcohol doesn't disappear. It gets absorbed. Alcohol can get absorbed from anywhere, including the stomach. It's one item that can be absorbed from the stomach. This is why people always advise, if you want to drink alcohol, don't drink on an empty stomach because the absorption is too fast. So when alcohol gets absorbed through the gut, it's in the blood. It goes everywhere. It can go to the brain. That causes a brain fog. It can cause tiredness. And many, many years ago, we could test for the level of ethanol in the blood after asking the patient not to drink alcohol for 2 days. Some patients, I mean, you take blood as a basic blood, and then an hour later, then after that, you give them glucose and a glucose drink and glucose pills and a drink, and then we do the test again. And after an hour, it goes to the lab, and they will give us the ethanol level, the alcohol level. Ethanol is what people drink. And some of the patients I've tested, they've actually had 2 and 3 times the legal limit for drink driving without having alcohol. And actually, in one case, I've had a police send me a young man who was breathalyzed, but he didn't have any alcohol. However, when the police their doctor drew sample of a blood, it was positive for alcohol. So they have to send another sample independently, and somehow he got to me and I did the blood sample, and he was 3 times the limit. But that was, and then we did the special test, and it was candida in the gut. Yeah, so it was very dramatic, but unfortunately the lab stopped that during the pandemic, and the nutritional lab stopped operating. So this is one of the examples as why, well, am I tired? I'm doing everything correct, but I am tired. It's likely that that could be the reason. The other thing also which can affect our gut, which is very common in women, is endometriosis. You know, it can happen from the first period, from menarche, that a young girl has severe abdominal pain during period, heavy bleeding, and it's been passed, it's a period. And you know, on average, unfortunately, it takes 17 years to diagnose endometriosis. And endometriosis, really the lining of the womb, the lining of the uterus, there are cells that are similar to it, not exactly it, but very similar to it, can grow outside the uterus. It can get into the gut, it can get into the eyes, it can get into the skin, it can get into the lungs, it can get into the liver. So because these seeds go through the blood, and then wherever they land, they will grow into endometrium-like tissue. Well, what does that do? And what does this have to do with the gut? It's extremely inflammatory. And it doesn't have to be inside the gut to cause a problem. It's just that chemicals that is produced by it, it can create lots of inflammation, lots of cortisol, lots of pain, and that can affect also the microbiomes. So then they will be very negatively affected, that will then work together with those tissues, the abnormal tissues, the endometrial-like tissues, to create lots of problems. And it can be very debilitating. I tell you more things about new studies. There is a study that was done, not on human, on mice, for 7 years, and it was published only a couple of weeks ago it's called PLOS Biology. So what they did, they fed mice very fatty food that affected their gut. And when the gut was affected and the microbiomes got weakened, bacteria, abnormal bacteria grew, Clostridia, other ones, so they grew. What they found, some of these bacteria managed to climb through the vagus nerve branches, found their way all the way up to the brain, which was, seriously, it's mind-boggling. So they went, the vagus nerve, I mean, we all know as doctors and health professionals, it's a nerve. Vagus means the wandering nerve. It starts from the brain and it goes everywhere to all the organs, including the heart and including the gut and the ovaries and the testes. So those bacteria grew up all the way, not grew, but it climbed up and through the branches of the vagus nerve till they got to the brain. And they created problems in the brain, Parkinson's-like symptoms, Alzheimer's-like symptoms. Yeah, okay, we're talking about mice. But that experiment has been repeated over and over 7 years. And they said that the amount of bacteria, the number of bacteria, wasn't too much to create a proper infection in the brain, but it was bad enough to create changes in the function of the brain. They cut one side of the vagus nerve, and they found out when they did that the number of bacteria disappeared. So, and then they worked really on making it extremely sterile. So there's nothing going to the brain, no way, unless throughout this route. And now they are saying, concluding from the 7-year experiment, is if that is the same mechanism that is happening to human, then really our approach towards Alzheimer's, Parkinson's, and even dementia should change. That's the link. What else the gut is responsible for? Gut is responsible for 90% production of the serotonin in the body. 90%, 90 to 92%. However, the brain produces serotonin, which is roughly about 2% of the total body serotonin. That's the central serotonin. And that serotonin is different in structure. So that serotonin of the brain produced by the neurons and be uptake by the neurons, this is responsible for our well-being, to stay healthy, to stay happy. The gut serotonin is really it goes to the blood, but it does not reach the brain because it will be stopped at the blood-brain barrier. It cannot cross it. So it cannot really then enhance the individual's well-being. And the study was done on people who have the carcinoid tumors. So people unfortunately develop lots of tumors, and these tumors are serotonin producers. So they produce lots of serotonin. But unfortunately, they are not happy people, they are miserable people. So this serotonin is peripheral serotonin. However, the gut itself, through its a certain chemical pathway, produces and enhances the absorption of a tryptophan, which can go to the brain to be used to make the brain serotonin. So really, it's a very complex subject. It is an exciting subject. It's a subject that I really like to know more and more about, because it's not, you are tired, I did your blood test, I don't know what's wrong with you, I am sorry. We really need to understand, especially in women with period problems, with pain, is a big question mark. Is it endometriosis? Is it what is used to be called polycystic ovary syndrome, now is called the polyendocrine ovarian syndrome, PMOS? Because that is also very closely related to the gut as well. Because the gut can help metabolize estrogen. And if the gut is not healthy, that metabolism will be spoiled. And that can create insulin resistant, it can create gain in weight, it can create so many other issues. But tiredness is the common denominator amongst many conditions I have mentioned. Endometriosis, adenomyosis. But adenomyosis, it means there is glands growing within the uterus itself, they don't go anywhere. But they also can create issues for the gut, and they also can create tiredness. Generally, by itself, after courses of antibiotics, and there are some people, especially with a chronic tonsillitis since childhood, course after course after course after course, their microbiomes will be weakened. So they present as feeling very tired. Other things, salt. There are many people like salt. And I don't know whether you've seen, perhaps you notice people, I like observing people, like sitting in a restaurant. Once I was eating by myself, and a lady, there was no empty chairs, and she asked to sit next to me, and I said she's very welcome. She got the same food I've ordered. Just happened. But before she tasted it, she's got the salt. And to me, it was salty anyway. And I've asked her, I said, why did you put the salt? You haven't tasted it yet. She said, actually, yes. She said, that's a habit. I always do that. We at home, we always do that. Salt, according to the World Health Organization, which is allowed for a human consumption per day, is 4.5 grams. And there was a study, someone did studying the contents of sandwiches from good places, reputable places. So he bought a club sandwich, whatever it is called, from Gale. It had almost 7 grams of salt in just that sandwich. But when you read the ingredients, it's healthy. There's meat, there's salad, there's avocado, there's whatever, but actually 7 grams of salt, so by far exceeding the daily allowance. And he said when he had it, it was delicious. Absolutely, because that's what salt does for us, and combined with any dressing that has a bit of sugar or fat. So salt kills the microbiomes. It's poisonous, in addition to its effect on the kidneys and its effects on the liver, but the kidneys in particular. So sometimes, you get somebody, otherwise it's really healthy, but it's the high salt content in the diet that is the reason for their brain fog, their tiredness, their achy body, because it is electrolyte imbalance and gut imbalance. So we need really to take that into account. Very important. And we need to address it. We need to think holistically. Definitely we need to do that. So that's an important thing to do when we check a patient with those symptoms. Please keep in mind, we have to keep in mind endometriosis, adenomyosis, gut health, cortisol levels. Because when the gut is not healthy, when it is not producing its own serotonin, cortisol levels are up. And guess what the presentation is IBS. So IBS is not a brain issue per se, but there is a pathway. They actually call it gut-brain pathway or axis. So brain and gut talking to each other all the time. They're having this conversation. So either they agree to make us well, or they agree to make us unwell. So for us as medical professionals, we really need to understand these facts, and we need to address it. And we need to also educate our patients of the wide picture. Is not black and white. Thank you. So now I'm open for questions.
I was just saying that with the increased incidence of bowel cancer in younger people, I've been reading that it's more to do with the gut microbiome than purely our sort of assumptions of, people just aren't eating well, or it seems like quite a complex picture.
I think, in my opinion, the microbiomes do play a part, because they are responsible for 80% of our immunity. I'll give you an example. Somebody diagnosed with HIV, and if they are not treated in the olden days, in the 80s, then they develop AIDS, when their immune system is totally ruined. When I was a medical student, and I worked as a hospital doctor in AIDS unit, we were told to check for cancers in those people. Skin cancers also sarcomas, melanomas, and digestive system cancers. They were common in people with AIDS. So why is that? Because they don't have any immunity to protect them. So that makes it then logical and valid. If our immunity is not up to scratch, we can develop cancers. And the food young people are having, of course, we can't forget the genetic predisposition factors, smoking, alcohol, other reasons, but food, diet in particular, high-fat diet, low-fiber diet, is a precursor. There's reasons why people can have colon cancer. And now it's happening in younger people. You correctly said, and it was a report about a 21-year-old who died, unfortunately, a young man who died of stage 4 colon cancer. So it must be playing a role through the immune system.
Doctor, how we can recover this good bacteria after a long time of bad lifestyle and bad diet?
Well, this is a very important question, because now we know the facts. So what we're going to do about it? Starting with changing the diet. So we need to eat healthy, down-to-earth, balanced diet. We have to stop eating a processed and ultra-processed food. Fast food, crisps, chocolates, anything that is fancy and fast and delicious. It's very unfortunate. It's a price we have to pay. But we can make healthy food very nutritious, but we can make it also very tasty. So changing the food is very important. Increasing the greens is very important. So if some people say don't have time, they can't eat too much salad, I always say to them, make it into a smoothie and drink it, you know? Doesn't matter, put it in the blender, all your salad. Turn it into a smoothie, add coconut water, add kefir, add maybe some natural yogurt, kefir, drink it, you know? So because these are what's called the prebiotics. This is the food for the good bacteria. And reduce the saturated fats, because these are really very bad for the bacteria. Smoking, amount of alcohol, that is really very important. Sleeping well, because if we sleep well, 7 hours, hopefully uninterrupted sleep, that also helps healing of any cell. But you know, as a fact, every 6 months, every single cell in a human body regenerates, including the bones and the enamel of the teeth, every 6 months. Apart from the red blood cells, it's 120 days, they regenerate. Imagine if you give yourself the right ingredients, you're going to have healthy, happy, young cells. So food and diet is very important. Lifestyle, regular, not a strenuous exercise, but regular nice exercise, resistant exercise, laughter helps regenerate the gut, believe it or not, and make the immune system happy, because the brain then starts reducing the stress hormones, reducing the cortisol levels, gut will flourish. So this sort of thing. Also, there are supplements. You can take probiotics, different type of probiotics. One type of probiotic has been studied. I leave it to you to check that and Google it. Taking supplements of probiotics, whether capsules or whether it's in a drink form, whether it is you make it at home with water, kefir, kombucha, whatever, you know, you can buy from any health shop or Amazon. They have the granules. And then you put them with sugar and water, and then after a week or so, you will have your own kefir, so you keep on drinking. So this is all good bacteria. That's to replenish your good bacteria. If you ever been given a course of antibiotics, make sure you take a probiotics as well, high dose.
We know that endometriosis is linked to IBS.
Yes.
Or IBS is linked to endometriosis. Yes. So what advice would you give someone with endometriosis? Is the hormonal treatment? Or we can try with any probiotic treatment as a trial. Is it
Sure.
Should be useful?
Yes. Well, it's a difficult question to answer, because endometriosis is not straightforward disease.
It's complex anyway.
It's very complex, and it is multifactorial. It can affect any organ. And really, it depends on how early, which stage are we talking about. Of course, if it is an advanced endometriosis, it's really then a specialist, so it needs to be going to see a gynecologist, and depends really when is this endometriosis or these endometrium-like cells have migrated to. Sometimes you need to do respiratory physician or surgeon to remove them from the lungs. But how they are linked is really the common denominator is inflammation, high cortisol, which affects the gut in a very bad way, making the serotonin production, the gut serotonin, very low, not at the level that it is needed to protect the gut and the digestion and the microbiota and the absorption. And that creates leaky gut. It means all the toxins of whatever is inside, especially if there is endometriosis inside the gut, they will leak into the blood, and then that will create more seeds, and it's a growing ground to other masses. But to make the answer simple, like whether it is worth giving the same advice when I've answered my colleague before you, then why not? What do we have to lose? It's good overall. Let's improve their immune system, because they have low immune system. Let's keep their body healthier and better, so it can deal with the insult and the assault that the endometriosis is putting on them.
Do you think we could be doing more, Dr. Aboud, to educate patients about the link between antibiotic use and the microbiome? Because I think people are often aware of, I need to take a probiotic afterwards, but I'm not sure people are that aware of the harm that weakening the microbiome causes. And there's still a lot of request for antibiotics in the kind of modern day. So, yeah, I feel quite inspired after listening to you, and whether we could do more in informing patients about those specific links and whether that might reduce kind of overuse.
No, absolutely, 100%. Usually when I prescribe antibiotics when the need arises. Of course, we can't really not prescribe it if we suspect that there is any infection. But usually, if we can help it, which is always a good practice, is take a swab from whatever area that the patient is having the symptoms coming from. And if you suspect as a clinician there is a bacterial infection, then we prescribe it and then we follow. So we can stop the antibiotics if there is nothing grew. But I always explain to the patient, when you take antibiotics, the good bacteria will also be affected. So I would like you to start on this eating program with a supplement of a probiotics, kefir, and so on and so forth. They need to understand, because I said then it is counterproductive. We kill the bad bacteria, yet you lower your immune system by affecting, killing, or weakening the good bacteria, then your immunity cannot overcome the problem. So we really can't do one without the other. And that is always very important. And sometimes, especially mothers with young children insist on antibiotics. I can understand. They worry about their little ones. But if you say, well, look, it could be a viral infection. I sometimes give a prescription for antibiotics. I say, don't need to go on it straight away, because I know this is going to might need it, but wait to get my call about your swab. And that keeps them happy. And most of the time, then we don't need it.
Thank you guys so much, Dr. Ruth. Thank you so much.
It's a pleasure.